I'm here with Dr. Rachel Hardeman, Blue Cross Endowed Professor of Racial Equity, Founding Director, Center for Anti-Racism Research for Health Equity at the University of Minnesota, School of Public Health, to discuss a recent report and press release on maternal health that had some disturbing results regarding Black women and severe childbirth complications. Welcome and thank you for joining us.
Thanks so much for having me. I'm happy to be here.
Well, my first question for you is really kind of overall, what prompted Blue Cross to conduct this research and what were some of the most startling findings?
Sure. So I think what prompted Blue Cross to conduct this research is something that we've known for quite some time now, and that is that
Mhm.
Black birthing peoples, Black women, are 3 to 4 times more likely to experience maternal mortality and also almost 2 times more likely to experience severe maternal morbidity during the childbirth process or in that year postpartum. And this stark disparity has been a reality for a really long time, but I think
Right.
over the past few years, it's started to gain some momentum in the popular media and press, and some attention has been paid to the fact that overall, the United States is the only industrialized nation that has a rising maternal mortality rate. So we're the only industrialized country where moms are dying more frequently than they were, 50 to 100 years ago. And so and what we see is that what's driving that statistic is the fact that Black women are more likely to experience maternal mortality.
Wow. Wow. Okay. There's a lot there. One of the things when I was going through the report that was released, it said that Black women that live in majority Black communities have a 63% higher rate of SMM, which I found out was severe maternal morbidity, than women in majority white communities.
That's
Do
right.
you do you think this is mostly connected to racism, or are there other factors contributing to this disparity?
That's a great question. Before I answer that, I'm going to back up and just remind folks. So, severe maternal morbidity is an important term that's actually less known or less understood than maternal mortality. Because when we talk about maternal mortality, we're talking simply about someone dying, a mother dying.
Right.
Severe maternal morbidity is actually more frequent. And the way that the CDC, the Centers for Disease Control, defines severe maternal morbidity is as an unexpected outcome from pregnancy or childbirth, like kidney failure, respiratory distress, eclampsia. And these things can all, potentially lead to death, but also they can lead to sort of debilitating issues across the life course.
Right.
There's a list of about 21 indicators of severe maternal morbidity that are considered to be important when we talk about this topic. And so to the second part of your question around the cause, what's going on here,
Right.
there's a lot of ways to kind of dig into that, right? Because what we know is it's multifactorial. There's a lot of complex things that are happening in our society as well as in our healthcare systems that are contributing to these disparities. So I always start the conversation with the fact that the idea of the social determinants of health, which I think is becoming this sort of familiar
Right.
phrase for folks, the idea that where we work, live, and play matters for health. And in the same ways that it matters for other ways that we are healthy, whether we're able to exercise and things like that, so the social determinants matter for maternal health. I think the other piece of it that's important to understand is to back up a little bit to say, but why do the social determinants matter for health?
Right.
So why does where we live, for instance, dictate our health outcomes, our ability to be healthy? And the reason behind that, sort of at the root of that question, is racism, structural racism in particular, which has dictated policies and practices and procedures that are so deeply embedded in our day-to-day lives, and have dictated, for instance, where people have access to healthy or safe neighborhoods. It's dictated through redlining. Folks access our ability to get a mortgage and buy a home, or if they are able to get that mortgage, it dictates where or what neighborhood they can buy a home in. And we have to be able to make those links to both the sort of ways that historically we have created or embedded inequity into our systems, and how that shows up in the ways that Black women are being, and Latino and other women of color are being impacted when it comes to childbirth and motherhood.
Oh, absolutely. You said a mouthful there because I was just sitting here thinking, like, I was like, yeah, redlining plays an important role in that because even when you go back to from World War II, and that's not even going all the way back, you
Right.
go back to World War II, and Black soldiers were not allowed in great numbers to access the GI Bill, which allowed, and did even when they were able to access it, they weren't able to buy homes in safer neighborhoods. There were there's more healthier outcomes. They were redlined into poorer neighborhoods, and that kind of dictated some of the health outcomes for them and for their children.
That's exactly right. And we see that still happening today, right? And in different ways. So I live in Minneapolis. And what we see in Minneapolis is that we have incredibly segregated neighborhoods by race due to the reasons that you just described. And one of my recent research studies found that folks who live in these racially segregated neighborhoods are at greater risk of being surveilled by police. They are more disproportionately impacted by police contact. And we found that there's a significant association between living in a neighborhood with high levels of police contact and preterm birth. So being at risk of giving birth to your baby before 37 weeks gestation. And so these sort of historical ways that we've created inequity are now contributing to the contemporary ways in which these inequities are playing out in our communities.
Well, absolutely. I mean, you have stress of community, you've got stress of poverty, you've got stress of food deserts.
Yep.
In terms of nutrition, we know how important nutrition is for a baby and for a mother. And so if she doesn't have access to healthy foods, then that is going to impact the quality of her birth. And so there's all of these factors. And so I appreciate the fact that not only you're willing to sit down and study it, but you have a company that you're part of a network now that's willing to back that, and one of the largest providers in the nation willing to back that. So I applaud you for that. So, and that moves me to my next question, which is the response by BCBSA is significant. What impact do you think it will have on other conditions with similar inequitable outcomes?
That's a great question. And I agree. The findings from the Blue Cross Blue Shield Association report are incredibly important and significant as we talk about maternal health. And I would say first and foremost that making sure that our moms and babies are healthy and thriving is sort of should be of utmost priority and importance to our society, to our community, right? So in public health, we teach our students that the infant mortality rate, so the health and likelihood of survival of babies is an important and critical indicator of community health and well-being. That's what tells us how well a community is doing if all the needs are met. And so I think from that perspective, this report shines an important light on the fact that we are doing a disservice to our communities more broadly because we are not ensuring that moms and Black moms in particular are well cared for and are thriving. And as we think about sort of the root cause that we just discussed, that at the root of a lot of the inequities we see in our society that by race is racism, this report allows for an important conversation to continue. I think it's being had certainly over the past year, but I think it requires that we continue to have the conversation about racism as a fundamental cause of health inequities, broadly speaking, and also what that means for our role as whether it's as clinicians or as healthcare providers, as administrators within healthcare systems, as payers, right? We all have a role to play in dismantling what's at the root of the inequities in our society.
So you mentioned earlier that you're there in Minnesota, which is basically the hub of kind of ground zero, the jumping off point of. So how significant was that? Because I'm in Atlanta, and how significant do you feel like that incident with George Floyd was in having like this movement go on and other inequities being challenged? How significant was that?
Incredibly significant, both personally as a Black woman and as a Black mother, living, just 5 miles from where George Floyd was murdered, and actually where the murder took place is just a few blocks from my childhood home. Wow. And so, on a personal level, it certainly has been significant. It has impacted our day-to-day lives and just the way that we talk to our daughter about things and things like that. But I think as we think about the societal impact, and I've been reflecting on that a lot, given that we just hit that 1 year mark of George Floyd's murder. It has certainly, I think, forced the conversation around racism into the public sphere in a way that we hadn't been able to before, because folks couldn't look away, right? You couldn't unsee what we saw in that 9 minutes and 26 seconds, as George Floyd lost his life, right? You can't unsee that. And when you can't unsee it, you have to talk about it. And so I think folks who may have been supportive in the past or put their Black Lives Matter sign in their yard, but hadn't actually engaged in conversations and hadn't actually engaged in sort of the action steps to play a role in dismantling racism in their own sphere, are starting to do that. I wrote a piece actually that was published in the Star Tribune on the 1 year anniversary of George Floyd's murder, called Hopeful but Afraid to Hope. And I think it sort of sums up exactly where a lot of us feel right now, particularly Black Americans, because we're hopeful because we've seen a lot happen and a lot of important discussions and reports and things happen in the past year. But also I feel a little afraid to hope, right? Because we still have so much further to go. And I think it's going to take a lot more intentional effort and resources and to really achieve the true justice that we're seeking.
Yeah, well, that's the word, intentional. And I think ultimately, as Black Americans, we've kind of perpetually understood that there was two Americas, and
Right.
I think that unmasking, for lack of a better term, at that moment, opened up the conversation, and mainstream America. Okay, well, what's going on? And then they were able to listen. And so now that, because this maternal mortality has been going on for quite some time, but now we're fortunate enough, we're in a position now where people are willing to listen, and now we could do something about it. So I do appreciate that, and we're walking that line of saying, we've been saying this for all along, but now that we've got the right people that are listening, we can do something about it. So I do appreciate that. So thank you so much for that. I think the final question I have for you is, what's next for you in your office? Like, we've got this study, we've got this major company to say, and they've made this dedication. So I'm going to say this for people that are watching. They have decided they want to lower that SMM rate by 50% over the next 5 years. And so that is a significant undertaking when we're talking about all of those challenges that we have in front of us. To reduce that rate by 50% in 5 years is significant and monumental. So what's next? How are you planning to, are you doing another study, or are you going to dive into this particular issue and help out?
Yeah. So, man, there's so much work to do. And, that lowering the severe maternal morbidity rate by 50% in the next 5 years, I think reflects the urgency of this issue. And also it highlights the fact that, because some people will say, well, 50%, that's a huge task. It's a huge undertaking. But I think it's important to note that 60% of maternal deaths are deemed preventable. Right. And so, I serve as the co-chair of the Minnesota Maternal Mortality Review Committee. And what that means is that, every couple of months, we sit down and we review all of the maternal deaths in our state. We're looking at every single case and walking through the process of what happened, and deeming whether it was preventable, and also thinking about then what are the solutions? What are the policy solutions? What are the payer solutions? How do we make sure that A, this woman's life is honored, and B, that this never happens again? And so I think that we can get there. And there's a lot of intentional efforts like that of Blue Cross Blue Shield Association in doing that. And my work personally, so I'm an academic researcher. My role is really to create the evidence base that guides change. So both creating the evidence base for companies like Blue Cross Blue Shield Association to say, okay, this is where we need to focus our efforts. Here's how we invest resources in the solution. And also to think about how policy, what role policy change can play. So I'm thinking about these issues at sort of all different levels. And within the Center for Anti-Racism Research for Health Equity, the research center I lead, two of the things that we're focused on right now is again, we just talked about how the social contexts in which we live and exist contribute to our ability to access, receive, and achieve optimal health outcomes. And so we're looking at the impact of police violence, of living in communities where there's been high profile events of police violence on reproductive health outcomes. So we're looking both here in Minnesota, but also have just launched a national study. So we'll be able to look at population health level patterns across the country to really help inform the work that folks are doing on the ground. And then the other piece that I think is important, and we didn't get to touch on in this discussion, but that certainly is part of the work that Blue Cross Blue Shield Association is doing with their findings, is thinking about what this means within the context of the postpartum period. So what we know is that the severe maternal morbidity and even maternal mortality, it happens in usually in that 1 week to sort of 6 months postpartum. But a lot of folks aren't, after that 6-week postpartum visit, they're done. They're not seeing a care provider any longer. Women on Medicaid don't have access after that 6-week postpartum, period. And so, as we're thinking about policies to expand access to care in the postpartum period, and also, my research will be looking at what does 1 year postpartum care, comprehensive postpartum care look like, and how do we tailor it in a way that is responsive to the needs of Black women and Black birthing people?
Well, you're absolutely right. And I did an interview a couple of weeks ago, and we were talking about this very subject. And one of the things they found that worked in California was putting Black and brown women in like groups, like
centering groups, yeah.
that were in the same trimester, and having that group of peers that are going through the same thing to be able to share, come together, that improved their outcomes. And so that might be something that's part of that solution. I know I said that was my last question, but I do want to talk about the Omnibus Act, because I think that's important, and that plays a role, because we can't just talk about attacking it from one side. We have to tackle from all sides, and policies are an important part of that. So is your research going to be helping support that particular act getting signed and getting put into place?
Yeah, absolutely. So Representative Lauren Underwood has been an incredible champion of the Omnibus Act, and it's the most comprehensive legislation out there as it relates to maternal and infant health. And I think anything that my research and the research my team and center do to contribute to the passage of the Omnibus is, I think it's incredibly important.
Absolutely, absolutely. So if you don't know what we're talking about, look up, and call your congressman, call your state senator, call your representative, and show your support. Voice your support for this act so it can get passed, because we know how partisan Washington can be. And so we got to make sure that we get this act passed for our mothers so they can continue to be healthy and have healthy children. So thank you again, Dr. Hardeman, and thank you for your time. We appreciate you coming on. We'd love to have you back if you can. I know you're very, very busy. We'd love to have you back if you can. And anything we can do to show support for you and your research, please let us know, and we are here for you.
Thank you so much for having me.